Hello students, this is Dr. Manjunath working as an assistant professor in SMGFGC Kabbahalli, which is located in the district of Chamarajnagar. Today in this video I am going to discuss about socio-cultural determinant of health. There are large number of socio-cultural aspects are there. So these socio-cultural determinants are plenty. Among them, today I am going to discuss only about cultural practices, how these cultural practices have an impact on health. ಹಿಂದಿನ ಈ ಒಂದು ವಿಡಿಯೋದಲ್ಲಿ ನೀವು ಸಾಂಸ್ಕೃತಿಕ ಒಂದು ಅಭ್ಯಾಸಗಳು ಅಥವಾ ಸಂಸ್ಕೃತಿ ಎನ್ನುವಂಥದ್ದು ಹೇಗೆ ಜನರ ಆರೋಗ್ಯದ ಮೇಲೆ ಪ್ರಭಾವವನ್ನು ಬೀರುತ್ತೆ ಅನ್ನುವಂಥದ್ದನ್ನು ಈ ಒಂದು ವಿಡಿಯೋದಲ್ಲಿ ನೀವು ಕಲಿತಾ ಹೋಗ್ತೀರಾ. This video definitely will be useful to the 5th semester BA Sociology, particularly of Medical Sociology course of Mysore University, and it is also useful to other universities which have the same syllabus. So here you can see that this is with reference to second chapter, Constructing Illness and Health. I already told you session's topic is socio-cultural determinant of health, particularly with reference to cultural practices. In the previous session, I had discussed about how nutrition has an effect on health. So and also what are the side effects or diseases which are faced due to poor nutrition or malnutrition. So these things you have learnt in the previous session, and in this video we have an learning objective, so that students will definitely become familiarized with the effects of cultural practices on health. What kind of effect the cultural practices have, you can see. And even session outcomes, after this understanding of this session, so students will be able to understand the relationship between culture and health. So and also they will be more aware about the impact of cultural practices in health and illness and all. So in this video I am going to discuss about these aspects, which you can see that so cultural views of health, and what are the cultural influences on various aspects of health, and even importance of culture, and a list of culture based illnesses and other things, and also some multiple choice questions are given to test your acquired knowledge. So culture is a very fundamental aspect in any society. Without culture, humans cannot exist. This is a well known fact, and even so everybody knows about that. So culture is a pattern of ideas, customs, behaviors shared by people or a particular group of society. So this is very important. It is culture is constantly evolving. The speed of cultural evolution varies from society to society, from person to person. Culture changes, from region to region culture changes. So culture always it is changing. So culture, you already know, from one generation to another generation it gets transformed. So it increases when a group migrates to another group and also incorporates components of new culture into their culture of origin. This is very important. And children often struggle with being between culture, particularly old culture and new culture. So they essentially belong to both. That is very important, whereas their parents often belong to predominantly old culture. So one way of thinking about culture is whether they are primarily collectivist culture or individualist culture. So knowing this difference can help the professionals, particularly health professionals, to give a treatment or diagnose the people. So cultural background is also important to know these things. So all cultures have systems of health beliefs to explain what causes illness and how it can be cured. ಈ ಸಂಸ್ಕೃತಿ ಎನ್ನುವಂಥದ್ದು ಆರೋಗ್ಯದ ಮೇಲೆ ಪ್ರಭಾವವನ್ನು ಬೀರುತ್ತದೆ ಅನ್ನುವಂಥದ್ದನ್ನು ನಾವು ಅನೇಕ ಒಂದು ಅಧ್ಯಯನಗಳಲ್ಲಿ ನಾವು ನೋಡ್ತೀವಿ. ಸೊ ಒಬ್ಬ ವ್ಯಕ್ತಿಯ ಸಾಂಸ್ಕೃತಿಕ ಹಿನ್ನೆಲೆಯನ್ನು ಅರಿತು ಒಬ್ಬ ಡಾಕ್ಟರ್ ಟ್ರೀಟ್ಮೆಂಟನ್ನು ನೀಡಿದರೆ ಆ ವ್ಯಕ್ತಿಯ ಒಂದು ಆರೋಗ್ಯ ಅತಿ ಬೇಗ ಸುಧಾರಿಸುತ್ತದೆ ಅನ್ನುವಂಥದ್ದನ್ನು ನಾವು ಇಲ್ಲಿ ಕಾಣ್ಬೋದು. ಸೊ ಹೌ ಇಟ್ ಕ್ಯಾನ್ ಬಿ ಕ್ಯೂರ್ಡ್ ಆ್ಯಂಡ್ ಟ್ರೀಟೆಡ್ ಆ್ಯಂಡ್ ಹೂ ಶುಡ್ ಬಿ ಇನ್ವಾಲ್ವ್ಡ್ ಇನ್ ದ ಪ್ರೋಸೆಸ್, ಆಲ್ ದೀಸ್ ಥಿಂಗ್ಸ್ ಆರ್ ಡಿಟರ್ಮೈನ್ಡ್ ಬೈ ಕಲ್ಚರ್. ಸೊ ಕಲ್ಚರಲ್ ಡಿಫ್ರೆನ್ಸಸ್ affect the patient's attitude about medical care and medical treatment also. So this is very important. Here you can see that the influence of culture on health is vast. It affects perceptions of health, illness and death, beliefs about causes of disease, that is also is based off from the culture. So and how a person approaches to health promotion, illness, pain, and all these things are primarily based from this culture. So cultural bias may result in very different health related preferences and perceptions. Being aware of and negotiating such differences or cultural competence, we can say that cultural competence is very important. So this cultural competence perspective allows doctors to ask about various beliefs or sources of care, how they have to promote these cultural aspects and all. So overall culture is a pattern of ideas, customs, behaviors and all. So these patterns identify members as part of a group and distinguish members from one group to another group. So it includes all these aspects and all. So this is very important. You can see that. So when we see cultural views of health, when we see these conditions are, there are a lot of sociologists who have a cultural views of health, and health is a very important aspect while dealing with the cultural aspects. So health is a cultural concept because culture frames and shapes how we perceive the world and how we experience it. So that is very important. Along with other determinants of health, culture helps us to define how patients and healthcare providers view health and illness. That is very important. So what patients and healthcare providers believe about cause of disease also, we get it from that. For example, some patients were aware of germ theory and may instead believe in fatalism. So in rural places and all, the evil spirit will be there. So that seizes infants and is responsible for some illness and all. So the evil eye, particularly in India, many people believe that evil eye or some kind of demon. So they have some kind of perception about that. So we have to think about that also. So and even a condition that is endemic in population may be seen as normal, and it's not an illness. Some people they don't define it as an illness. For example, in Africa, malaria was not considered as an illness. So there are some kind of generalizations about culture specific health beliefs also. So they may not accept diagnosis for evil eye and all, and they may even believe they cannot change the course of events. Instead, they can only accept what are the circumstances which are going to be unfolding in the future. So they will just accept it. So culture affects on how and which diseases or conditions are stigmatized and why. In many cultures, depression is a common stigma. Seeing a psychiatry means a person is very crazy. People think like that. So even Frederick Engel's book, he wrote a book about the conditions of working class in England. So in that one he describes about living and working conditions and limited health care. So this is also one of the best book to address health issues in England, particularly in the previous generation. And culture affects on what type of health promotion activities are practiced and recommended and other things and all. So this how illness and pain are experienced ಆ್ಯಂಡ್ ಎಕ್ಸ್ಪ್ರೆಸ್ಡ್ ಆಲ್ಸೋ. ಈ ಒಂದು ಸಂಸ್ಕೃತಿ ಅನ್ನುವಂಥದ್ದು ಒಬ್ಬ ವ್ಯಕ್ತಿ ಯಾವ ರೀತಿ ಅನಾರೋಗ್ಯವನ್ನು ಅವನು ಅನಾರೋಗ್ಯವನ್ನು ಸ್ವೀಕರಿಸ್ತಾನೆ ಅಥವಾ ಅನಾರೋಗ್ಯದ ಜೊತೆ ಹೇಗೆ ಅವನು ಡೀಲ್ ಮಾಡ್ತಾನೆ ಅನ್ನುವಂಥದ್ದನ್ನು ಕೂಡ ಸಂಸ್ಕೃತಿ ಅನ್ನುವಂಥದ್ದು ನಿರ್ಧರಿಸುತ್ತೆ. ಸೊ ಹೌ ಇಲ್ನೆಸ್ ಆ್ಯಂಡ್ ಪೇನ್ ಆರ್ ಎಕ್ಸ್ಪೀರಿಯನ್ಸ್ಡ್ ಆ್ಯಂಡ್ ಸೊ ದಿಸ್ ಈಸ್ ಡನ್ ಥ್ರೂ ದ ಕಲ್ಚರಲ್ ಆಸ್ಪೆಕ್ಟ್ಸ್ ಆಲ್ಸೋ. So in other cultures people openly express moderately painful feelings, and in some cultures they don't express severe pain also. So the degree to which pain should be investigated or treated may differ. So in western countries small pain is considered as a big pain, and in tribal culture or even in villages also, so heavy pain also is not considered, not given attention to it. So even patients interact with care providers, so that is also very important, with whom they go and with whom they talk. And so for not making direct eye contact is also sign of respect in many cultures. But these doctors wonder if the same behavior means his patient is depressed or something like that. So that is culture affects many large number of these things and all. So how cultural influences on various aspects, then what type of health promotion activities are practiced, so that is also one of the major thing. And acceptance of preventive and healthcare system is also based on this kind of cultural aspects. So this is also one important aspect. So here you can see that how patients and health providers perceive chronic diseases and various treatment options and all. So here there is an importance in the culture about patient-centric care. So nowadays it is growing, the recognition is there about culturally safe and patient-centered care in improving health of people. So ಇಂದಿನ ಒಂದು ಆಧುನಿಕ ಯುಗದಲ್ಲಿ ಈ ಒಂದು ಅನಾರೋಗ್ಯಕ್ಕೆ ತುತ್ತಾದಂತಹ ಒಬ್ಬ ವ್ಯಕ್ತಿ ಪ್ರಮುಖವಾಗ್ತಾನೆ ಹೊರತು ಈ ಒಂದು ಮೆಡಿಸಿನ್ ಸಿಸ್ಟಮ್ ಪ್ರಮುಖ ಆಗಲ್ಲ. ಹಾಗಾಗಿ ದಿಸ್ ಹೋಲ್ ಸಿಸ್ಟಮ್ ಈಸ್ ರಿವಾಲ್ವಿಂಗ್ ಅರೌಂಡ್ ದ ಪರ್ಸನ್ ಹೂ ಈಸ್ ನೀಡೆಡ್ ದಿಸ್ ಮೆಡಿಸಿನ್ ಆ್ಯಂಡ್ ಆಲ್ ದೋಸ್ ಥಿಂಗ್ಸ್. So culturally, safe approach to patient-centered care, benefit individuals, providers, governments, and other things, and all the institutions, and all those things. So this demonstrates awareness about patients' culture can promote trust and better healthcare systems and all. ಸೊ ಇಲ್ಲಿ ನಾವು ನೋಡ್ಬೋದು, ಈ ಸಂಸ್ಕೃತಿಗೆ ಸಂಬಂಧಿಸಿದಂತೆ ಅನೇಕ ರೀತಿಯಾದಂತಹ ಕಾಯಿಲೆಗಳನ್ನು ನಾವು ಇಲ್ಲಿ ಲಿಸ್ಟ್ ಮಾಡಿದ್ದೀವಿ. ಸೊ ಸಂಸ್ಕೃತಿ ಎನ್ನುವಂಥದ್ದು ಹೇಗೆ ಒಬ್ಬ ವ್ಯಕ್ತಿಯ ಅನಾರೋಗ್ಯದ ಮೇಲೆ ಒಂದು ಪ್ರಭಾವವನ್ನು ಬೀರ್ತವೆ ಅನ್ನುವಂಥದ್ದು, ಇದು ಕೇವಲ ಸಂಸ್ಕೃತಿ ಆಧಾರದ ಮೇಲೆ ಇರುವಂತಹ ಒಂದು ರೋಗಗಳೇ ಹೊರತು ಇಲ್ಲಿ ನೋಡ್ಬೋದು. ಸೊ ಲಿಸ್ಟ್ ಆಫ್ ಕಲ್ಚರ್ ಬೇಸ್ಡ್ ಇಲ್ನೆಸ್ related to body balances, emotional based sickness, fright sickness, supernatural power. Some people believe that there are supernatural powers which can create some kind of negative energy and negative feelings also, and it affects on the peoples. And black magic also, some people believe in that black magic. But in India, majority of the people who are living in rural areas, so they still have a blind belief, and they think that so this evil eye is an important aspect in determining one's sickness or illness. So it affects on the people's illness also, and so they will be going and trying to do some black magic also, which affects on particularly in the rural areas. This is also one of the important aspect. So evil eye is a widespread concept which is existing even not only in the rural areas but also in urban sectors, particularly in Indian society. And there will be some culture bound syndromes. So in overall you can see that cultural factors are highly involved in matters of personal hygiene, nutrition, immunization, seeking medical care, and etc. So today in this video you have learnt about culture, what is culture and how culture is influencing on health particularly. So if culture is supporting some health systems and all, then there should be a proper utilization of that system. There are even today, even in modern society, there are some cultural beliefs which are directly affecting on the health of the people. So hence culture should not be neglected in health and healthcare provisions. So in even modern allopathy, the doctors should not neglect the cultural impact or influences on one's health, because that gives a positive energy to the person and who believes it about that. So while giving a treatment to the people, they should also understand the cultural background of one person whom these doctors are providing health care. So thank you for watching this video.